Hello, I'm Eric Friedlander, Secretary of the Cabinet for Health and Family Services. And I have with me today...
Hi, I'm Keith Knapp. I'm the Senior Advisor of Adult Programs for the Cabinet and working with the Secretary on matters that involve and affect the lives of older and disabled Kentuckians.
So today we're going to talk a little bit about long-term care. Keith has been leading our long-term care task force, which has been made up of folks across the Commonwealth, really experts in the field, who have been advising us as we've been looking at long-term care and working with the nursing facilities across the Commonwealth again, and making sure that what we're doing is science and evidence-based and can actually be implemented, and has been tremendous at leading us in that.
Yeah, we've been really fortunate to be able to capitalize on the fact that Kentucky is such a national headquarters for aging services,
Right.
that we can really pull from subject matter experts that are in our backyard and willing to pitch in with exactly what you were describing and make our every next move well informed based on what's going on nationally and the science behind it.
Right, and that task force has helped us come up with guidelines, and this week is the week that we've actually opened some of the nursing facilities for visitation, and that's very important, both to residents and family.
Yeah, it's been bubbling up for a while because you've got these competing interests of wanting to protect frail people from the ravages of this darn virus. But we know, well before this, but it's come out in capital letters about how isolation over an extended period of time can be really troubling for older and frail adults, and even more so for people that are cognitively impaired and don't understand why is all this happening. And you might explain it and have to re-explain it several times a day.
Right.
And it's tough.
It is very tough. It is very tough. But the task force has provided us some really, really good pieces to move forward, and how we might be able to do that safely. Clearly the virus has been, you can look across the country, across the world, and see that those kind of shared living, congregate living facilities are the ones where this virus really has gone for.
Oh yeah, I mean, just the makeup of it, you put that many people with underlying conditions that make the virus particularly effective in close quarters. It's no surprise that it's a tough thing to overcome.
Right.
So, you know, there's no approach we've been able to come up with yet that is what you could describe as risk-free.
Right.
You know, we can only really try to balance those two competing needs and try to find a middle ground that can keep people as safe as we can make it,
Mm-hmm.
and still exercise judgment about what's going on around the facility and the community at large, because that's who's coming and going if we open up. And there's not a one-glove-fits-all sizes answer to that.
It is that we're just trying to look, I call it the Goldilocks and the Three Bears solution, right? You're just trying to find the best possible.
Just right.
Just right,
Yeah.
right.
Yeah. And even then, it's so dynamic that what could be just right today might be very different by the day after tomorrow.
Right.
And it's not just linear. It's not getting just better, better, better. It's better, better, worse, better, better, in almost a ratchet form. So it may seem to some a little counterintuitive that while we're hearing reports of the community spread continuing to rise, why now? Well,
Right.
it's that very thought, if not now, when?
Mm-hmm.
And can we find a balance?
Right.
And so it's still more of an art than a science, but we're hopeful that it can be successful.
Right. So can you go over a little bit like what the guidance is for nursing facilities,
Sure.
and maybe a little bit what families might be able to expect?
Sure. I mean, there is a cascading order of let's make sure we get minimally safe with distance and masks and hand washing and checks, temperature checks at the door. But then beyond that, in order to kind of almost like a lifeguard at a swimming pool, we're expecting the providers to have a person assigned to the visit, and play kind of referee around. We got to keep the distances, and I know everybody's wanting to get that hug in, and we're just not at hug yet.
Right.
We will be on the game board eventually, but this is a step in that direction. So those are the chief concerns, is try to minimize the opportunity for the virus to move from one person to another when we're introducing people into that space that have been out in the community.
Right, and opportunity is an important word here,
Yeah.
because this is the opportunity for nursing facilities, given a bunch of factors,
Yeah.
right, to allow some visitors in, and it's an opportunity, not a mandate. But can we talk about some of that opportunity for the nursing facilities?
Sure,
to
you know,
consider?
because I think when people are eager to, you know, see mom or grandma, what you hear is it's open, you know, fling
Right.
the doors.
Right.
And that's not really what we're saying. You say, okay, given all these things, if you can manage to do these things, and it's in the context of what's going on in your community, let's take baby steps. So they will be scheduled ahead of time, and only so many at a time, and different facilities are configured in such a fashion that they'll be able to commit maybe just one or maybe more than one space for this activity. But what mainly needs to happen is they don't cross paths and they don't have that exposure opportunity. So yeah, opportunity is a key word in all of this.
Right.
And then execution with good judgment. We will have to just monitor and see how well it goes. So there are some facilities. I failed to mention one thing. For the nursing homes, it's the CDC and CMS recommendation that we're following around having gone 28 straight days without a new COVID
Right.
case
Right.
in the building.
Right.
So if someone on July 15th, when this started, hadn't yet gone 28 straight days, it may be a few more days before they can really start doing this. And that kind of is buried in the fine print. And so if someone hasn't heard that and the facility they want to visit isn't opening, it's not because they're being stubborn necessarily. They're really trying to follow the guidelines.
Right. Right. And those guidelines, as we look across the country, Kentucky stacks up pretty well in terms of our early adoption of, really not allowing visitors, and our slow reopening to visitors. I think we stack up pretty well.
That's had a big impact on both our morbidity rate, how many people are getting sick, and our mortality rate, even though there's been lots of reports about how many have died in that setting.
Right.
Compared to other states, it's horrific, no question about that, but it's not as bad as the states that surround us.
Right. Right. And that's important.
Yeah.
And I hope that gives some folks some reassurance that even though we see the numbers on the governor's press conference each night, and it's stunning, and it's sad, and it's tragic, know that holding that is true. But as we look across the country, we're doing relatively well.
Yeah, I wish it could be nothing.
Yes, absolutely.
And we'll get there eventually.
Right.
But we're starting off with a pretty darn frail group of people,
Right.
and managing a lot of other things at the same time. We don't just stop treating everything else because there's COVID to deal with. It's just an additional factor on what we have to deal with.
So the reason we're talking today is that it is great. It is important to go visit. If you can go visit, you should. It's a lifeline for families. It's a lifeline for residents. I worry that we haven't had the same number of eyes on folks, right? Across the Commonwealth that we would normally have. So if you can go visit, if your facility is open and will allow that, I do encourage you to do that. It makes a tremendous difference in people's lives.
Now, because of the scheduling issue, if it's a larger facility, that may take longer between visits,
Right.
even.
Right.
And so we did open up the Civil Monetary Penalty Fund has made it possible for now over 200 facilities have taken advantage of getting the equipment to do televisits.
Mm-hmm.
And so, everybody from schoolrooms to Sunday school have learned a little bit about Zoom and FaceTime, Facebook Live. It's not really a substitute for that visit, but you can complement the time between visits with that kind of technology. And now the vast majority of our facilities have at least one, some more than that, the ability to do that. But you probably need to schedule that too, because they're not in every resident's hand.
Right. Right. But that's an important piece that we've been
Yeah.
trying to support.
Connect.
It's that connection.
Yes.
And some facilities even come with some very creative. I saw a Boy Scout the other day that created a plexiglass
Made an
board.
Eagle project out of it.
Yeah.
Yeah.
So we'll continue to try to be creative. We continue to encourage our nursing facilities to be creative. try to encourage as much connection as we can because it's important. And we understand how important it is. But remember, the thing that we are trying to do most of all is save lives.
Save lives.
And to keep people safe. That's job one, that's number one, that's what we're trying to do while balancing all those other needs.
Yeah, it's got a lot of moving parts.
It does. We have a medical ethicist on our long-term care task
Yeah.
force who does reinforce to us that as we prioritize what we're trying to do, that keeping people safe, healthy, and alive is the most important thing.
Yeah, that's the starting point, and then what can you build around that?
Right, and that's what we've been trying to do from the start. So thank you for this. If you have any other questions, always go to the kycovid.com link, and there will be information there. You can always ask your questions through CHFS Listens. It's a email box. Please do. We're here. We're trying to do our best, and we'll get through this, and we'll get through this together.
You bet.
Thank you.